Turning to our coronavirus crisis coverage tonight, the state of the health department reports more than 730,000 Hoosiers have received the first dose of the COVID-19 vaccine. State officials claim Indiana could vaccinate even more if they could get more doses. CBS 4's Russ McQuaid has more on that and other news from Governor Holcomb's weekly update. Good afternoon, Russ.
Hey there, Bob. Well, you know, there are 290 places in Indiana where, in theory, you should be able to get the COVID-19 vaccine. There's another 160 pharmacies who say they'll be ready to come online this weekend. There are even 10 mobile units stashed at the State Department of Health that are gassed up, ready to go to hit the back roads of Indiana to inoculate rural Hoosiers. If only we could get the supplies. A vast majority of those people who have received at least the first dose of the COVID-19 vaccine are 65 or older. Next up on the priority list, 432,000 Hoosiers between the ages of 60 and 65. And then officials will consider lowering the minimum age to 50. And that would include state residents who have one of 6 more major comorbidities that put them at a high risk from COVID-19. Then state health officials announced they will consider the 51,000 people under the age of 50 who have those comorbidities, which include patients on dialysis or with cancer, organ transplant recipients, or Hoosiers with Down syndrome.
We continue to use data to drive our decisions. We reviewed risks based on age and the CDC's list of conditions that lead to an increased risk of severe illness from the virus. We know that these categories do not include all Hoosiers who have conditions that could put them at greater risk from COVID, but we are working to expand to those most at risk as quickly as our vaccine supplies allow us to do so.
So, of course, the question you're asking is, when can you get your shot? Well, there are about 100,000 doses of the vaccine coming to Indiana every week. And until that number goes up, which may happen in the weeks to come as more vaccines come online, state officials are not ready yet to announce a timetable when they're going to expand their priority list. In downtown Indianapolis, Russ McQuaid, CBS 4 News.
All right, Russ, thank you for that update. State officials are working with the federal government to get vaccines to underserved areas. The state health commissioner says they are working with the White House to help get vaccines to federally qualified community health centers.
Many of those sites are in areas of our lowest socioeconomic populations, higher minority populations. Dr. Weaver and her team very wisely reached out and engaged them to give vaccine not just to their patients, but to their communities in general because of their locations.
State health officials say they have identified 44 sites across the state that could receive vaccines. It's still unclear when those vaccines will be provided.